I am a South Carolinian and a physician. I went to Clemson University, the Medical University of South Carolina, trained there in general surgery, did vascular surgery, Dr. DeBakey in Houston, and was in the Air Force, and came to Greenville with the Greenville Health System, where I was a staff surgeon, former chair of surgery, was the planning dean for the University of South Carolina School of Medicine, so I was that guy that helped put the medical school together, and then eventually became president of the Greenville Health System, first physician president in 2016, and left the system in 2019 as part of the merger, and have been doing consulting work and writing since then. In 2019, I thought I'd left the health business, and what I discovered was that probably 2 to 3 times a week, and that number has probably doubled since 2019, I have been approached by patients trying to navigate the health system. They can't get in the health system. They can't find a doctor. They have scheduled appointments that are months out. They have access to the doctor, but they can't get in to see the doctor, so I've been helping them navigate this through. And eventually I was approached, they said, you know, you could turn this into a business. You could make this a concierge business to help navigate people. I told them I was not interested in that. They said, well, then do the other. Maybe you should fix healthcare, which put us on an interesting path. And that path was to do a little research, find out where the healthcare system is, and then can we construct some type of a company that can fix it? And thus we created Integral Leaders in Health. So from our research, what is the medical care crisis, as we're calling it, and it is evolving. And from our research, we've come up, this is what we're saying is the ABCs of the medical care crisis. It's lack of availability. We have unbelievable access to all these hospitals, doctors, but you can't get in to see them. It's the 6-hour wait in the emergency room, or I can't find a family doctor type thing. Burnout, massive burnout of professionals leaving the professional. Corporatization, it's this idea that the components, the well-being of the components of the healthcare system take priority to the well-being of the patient. You see multiple examples of this. Depersonalization. I have 3 examples in the last year where a patient was texted the diagnosis of cancer. One was terminal, over their cell phone. Depersonalization. Exploitation of non-clinicians. Administrators are put in a terrible position of having to schedule tests without any clinical knowledge of what should go first. And then last is failed communication. We have a communication crisis in this industry, or in this profession, where we need to make that a priority and make that front and center. So that's what we found, and those are the symptoms or the features of the medical care crisis. And what the healthcare system is a very intricate system where you have 4 components. Think of it as a table. It's like a table, and sitting on top of the table is patient well-being, and it's balanced by 4 legs: the doctors, the payers, the hospitals, the universities, and innovators, and it's totally balanced. And when it's working at its highest order, what we have right now is a system that is not balanced, where one leg is either fallen in or gotten shorter. And you'll hear the paradox of this, and you hear this all the time, and it's true. We in America have the best healthcare system in the world, and we do. We have the best hospitals. This is true for Greenville. This is true for South Carolina. We have the best hospitals, the best doctors, the best universities. We pay more money than anybody in the world, and we have a 70% dissatisfaction rate in medicine. Why is that? And the sports analogy that we always use is it's George Steinbrenner and the Yankees. He has a great baseball team but couldn't win the pennant. So it's not a matter that we need a better hospital, or we need more doctors, or we need more universities, we need more. It's the fact is we've got to balance the healthcare from an integral perspective, and try to recreate the balance that yields a high-performing health system that puts patient well-being as the forefront. The first thing we need to do is bring public awareness, and an awareness among the 4 components. I mean, it's easy, I've been there, it's easy as a leader of a medical group, for example, to say, well, we've got dissatisfaction, I need to work harder, or a lead of a hospital, I need to fix the hospital. The awareness piece needs to be, it's not that you need to be better, you're great, it's a matter you need to be balancing and working collectively with the group. So awareness and public awareness, and create a public outcry and something for these 4 components to say, that's where we need to go, is number 1. Second is that there's a very counterintuitive way to fix this, and the 3 competencies that you mentioned is autonomy, radical communication, and then self-leadership. And the autonomy is the most counterintuitive. The idea, if you were running one component of this unbalanced system, is I've got to integrate better. I need to control something. I need to control. If I'm a doctor group, I need to have my own hospital. If I'm a university, I need to have my own doctors. If I'm a hospital, I need to have my own. the counter. The truth is the opposite, and the opposite is I need to give more autonomy, give less control, more autonomy, create transactionality to create more transformation, and it's not counterintuitive. So the first out of the blocks after public awareness is, can we create more autonomy of the four components with a central mission, vision and mission, to create balance and bring awareness and set that standard of care for everyone, make sure we've got doctors for the future, make sure that everybody has care, make sure that the dollars work for us.